Good morning. Thank you, Melanie and Allison, for inviting us to present today. And thank you all for braving the rainy weather and for your time and attention listening to us today. Welcome to Recovery Link. Midwest Public Risk is a great organization. We're really proud to be associated with you and excited to share our Recovery Link program with you. I'm John Farley, co-founder and chairman of Kansas Regenerative Medicine Center. With me today is our other co-founder, president, and CFO, Ken Woods. My daughter, director of marketing and patient education, Kate Farley. Our office manager of our Kansas City location, Liz Messerly. Our workers' comp case coordinator, Paula Peeler. And our ARC representative, Adrian Struble. Also with us is our HR and compliance coordinator, my wife, Lori Farley. Kate will be talking you through much of this program today, but before she does, I want to introduce you to the main cog of our presentation. This guy is a seasoned veteran in the workers' comp space. He's been around Kansas City for a long time. He's been practicing good medicine since Moby Dick was a minnow. It's a long time. He's contracted with us through KC Payne and is our Recovery Link coordinator and workers' comp director. He's a really nice man. He'll be speaking to you shortly. Meet Dr. Howard Axe. I'd like to give you a brief history about how a banker and old cattleman ended up in the medical field. I know, very odd and untypical. 6 years ago, Ken Woods and I ventured out to Beverly Hills, California, Rodeo Drive to be specific, to get our stem cell treatments on our aching knees and shoulders. After several injuries, 9 surgeries between us, most of them either created by a cow, a horse, piece of farm equipment, or a head-first slide into second base, we decided we had to do something different. We simply couldn't fully function at work or play. And those stem cell procedures we got out there 6 years ago, they really worked for us. Allowed us to carry on our day-to-day activities. We really found the relief that we were looking for. And, you know, we really weren't looking to get into the medical field, but somehow the medical field found us, and it's become our passion. We knew that our farmer and rancher friends would never go to Beverly Hills, California for stem cell treatments. So we contracted some great doctors and brought this amazing medical technology to the Midwest, starting in Manhattan, Kansas 5 years ago, and here in Kansas City area a year and a half ago. And since our start, we've successfully treated around 2,000 patients for multiple injuries and arthritic conditions. We've created Recovery Link to expand our input by servicing workers' compensation patients, and that's why we're here today. We not only want to be your regenerative medicine services to your members and workers, we want to be your partner in regards to regenerative medicine. Regenerative care is where it's all going. We not only believe that, we live it. The FDA sees it, the Mayo Clinic sees it, and major research universities like Harvard and Stanford see it as well. Some say regenerative medicine, you know, is in the future, but the future's now. It's here. We feel truly privileged and humbled to be part of it. A leader in regenerative medicine from the start. But in the end, you know, it's not about us. It's about them. Thank you very much. Kate?
Hi. Recovery Link is designed to help public risk management pools like yours offer innovative and proven regenerative medicine to your members and their employees. Recovery Link puts the patient first. Can you hear me okay if I talk right here? Okay. Recovery Link puts the patient first by helping our partners link the hardworking people they serve to the best care available in regenerative. Sorry. We want to partner with you as your preferred regenerative care provider to launch and build our program. We are reaching out to you first because we feel that our goals best align with and support yours. By working together, we can make regenerative care available to more people, saving your members time and money by helping their employees get back to work and back to life with less pain, less time off, and a lower chance of recurrence. We've built Recovery Link on the same principles that drive KRMC. And we believe the same core values that make KRMC successful will do the same for Recovery Link. Quality. We know that doing it right and doing it well will always lead to the most significant savings in both time and money. And that's why we put the quality of our care above everything else. And this is a big differentiator between us and other regenerative options out there. When we founded KRMC, we didn't want to be another quick fix recovery pop-up that puts making money above helping patients. The way we do regenerative care is top of the line, and that's why our treatments are safe, proven, and effective. Integrity. We believe quality care isn't possible without integrity, which we maintain by being trustworthy and transparent. We only develop personalized recovery plans that we honestly think will work. And that is the foundation of building trust with every one of our patients and partners. These core values motivate the success of our current practices and will continue to motivate each decision that we make as we develop Recovery Link. We've always believed regenerative medicine would advance orthopedic care and accelerate patient recovery with procedures that are less invasive, less painful, less expensive, and ultimately more successful than surgical procedures. And we were right. Our team, led by experienced board-certified doctors, have helped almost 2,000 patients avoid invasive procedures and post-treatment complications. And people are starting to not only find regenerative care, but finding KRMC as one of the highest caliber providers of this treatment. Look how far they come. And as we zoom in on the Midwest, if we kept zooming, the dots would only keep multiplying. We know that regenerative care is not an alternative, but a solution that provides safer, faster, and more cost-effective care. The word is getting out. This is very exciting for us after only 5 years. Because orthopedic injuries are common in the workplace, we realize that regenerative medicine is the perfect fit for workers' compensation patients and another way of reaching our goals. We offer medically proven, extensively researched regenerative treatment options for many common workplace injuries and chronic pain conditions. For example, this includes neck and upper back pain, rotator cuff tears, spinal disc issues, hip injuries, arthritis, nerve entrapment, ACL and meniscus tears, tendon injuries, ligament sprains, and many more. It's noteworthy that in workers' comp, backs are a common injury of source of reoccurring pain. We at Recovery Link treat backs, differentiating ourselves from other regenerative providers. Now, we want to offer you a quick primer on stem cell regenerative medicine in case it's new to you. Our regenerative treatments enable a patient to utilize their own stem cells to accelerate healing and naturally replace lost or damaged tissue. On a basic level, stem cells are cells that can renew themselves and turn into other cells. We store supplies of them in different parts of our bodies. ready to deploy whenever other cells are damaged. As we age or experience big injuries, our stem cell movement slows, and recovering from injuries takes much longer or may not be possible without assistance. That's where regenerative medicine can help. In a minimally invasive and nearly painless procedure, we collect stem cells from a supply in the patient's body where they are not needed and reintroduce them where they are. Once placed, the stem cells will communicate with their surrounding cells and coordinate the healing necessary to replace lost or damaged tissue at the site of an injury or chronic pain. Stem cells do not just act as a Band-Aid to repair damaged tissue. They replace it with new healthy tissue. Because stem cell therapy is an outpatient procedure that only takes a few hours and does not require general anesthesia, it's much less expensive, has a quicker recovery time, and is far more convenient than surgery. Let's take a real life example. Lots of people doing manual labor can end up with back issues, and that's an area we commonly treat and do very well with, as I've said. So let's take a herniated disc to compare what happens following the surgical versus regenerative care routes. The guy on the left gets a discectomy, which is removing the herniated disc and is a very typical workers' comp surgery. That surgery is going to cost around $50,000. If the patient has a low strenuous job, he might recover in 6 to 8 weeks before going back. If, like this guy, he's lifting and has a physically demanding job, it might be closer to 3 months before he can go back, during which he is undergoing extensive PT. Not only that, this surgical procedure doesn't fix the problem long term. He's in for future disc degeneration and degenerative disc disease. Workers' comp systems want him back on the job, and the surgery will do that. But it's expensive, painful, and a long road to recovery. Further down that road, he will have more issues with the same area, which to us is taking care of the issue, but not the problem. Besides, surgeries have a higher chance of injury recurrence, and even worse, the potential for opioid addiction from the post-surgical pain meds. Now, repairing the same injury with regenerative cell therapy, like the gentleman on the right, might cost around $10,000. That's $40,000 less than the surgical patient. He will be back on the job much sooner with minimal and hopefully no pain, so no opioid issues, and have a higher chance of success rate. We designed Recovery Link to help partners like you put patients first by streamlining the process and offering solutions that accelerate recovery, reduce spending, and avoid post-treatment complications and system fraud. We provide regular follow-ups and accurate patient records that make navigating the system easier by getting patients from injury to maximum medical improvement and closed cases with tight communication and less room for error. And in fact, we stand on this principle of proactive and excellent communication. And we know how important that is when navigating the workers' comp system. Communication gaps and inaccurate records cost time and money with unnecessary appointments, tests, procedures, and time away from work. Lags in communication also make it easier for patients to work the system and are a point of frustration for everyone involved. We also know that this is all much easier said than done, and managing workers' comp cases is a whole different hill to climb. That's why we've contracted with KC Payne, recruiting Dr. Axe for his services to help us develop, coordinate, and lead our Recovery Link program. Dr. Axe has over 30 years of experience working with workers' compensation patients, and he knows how to navigate the system and manage our caseload to maximize our impact while not overextending our resources. I've invited Dr. Axe to talk to you about how the Recovery Link journey is designed. Dr. Axe?
Well, thank you, Kate. My daughter saw that picture and she says, "Dad, you're really old." And I said, "Yeah, you're right, honey, I am." Thank you, MPR, for giving us this opportunity to talk to you today about something that I think is going to be a game changer in medicine, and that's regenerative therapy. I've been practicing medicine for 35 years now, and I can't tell you how excited I am that we have finally found a way to utilize our natural healing capabilities to heal us. This stuff works. It's exciting. The science is there now. The outcomes are showing themselves. And what's really cool about it is we're just at the tip of the iceberg. I've been interested in regenerative therapy. I got interested in regenerative therapies because I got tired of having a certain population of my patients that I could not help. Even though some of these traditional interventional pain procedures that I do, they have significant value, and most of the patients that come see me do get better, there's always those that don't. And as a physician, that's extremely frustrating to me. So I started looking at alternatives and other things to offer my patients, and that's how I found regenerative therapies. When I started incorporating these therapies into my practice, I was thoroughly amazed. And there's actually a few people in the audience today that have had these therapies done, and they might speak about it later. But before we start talking about our program, Recovery Link, I want to talk a little bit more about these therapies. So let's talk about Regenerative Therapy 101. So what are the pros? Well, number one, this stuff is very safe. There's very few side effects and complications. Probably one of the most common complication of what I do and what my surgical colleagues do is infection. It happens. It's nobody's fault. It's just the way it is. We don't see that with regenerative therapies. And the reason being is because we're actually taking the things out of you and giving it back to you that you'd normally have to fight off infection. These products are actually antimicrobial. I've never seen an infection with regenerative therapies. Number two, savings. As Kate just alluded to, there are huge potential savings with these therapies. And she just gave you an example of two gentlemen that had a herniated disc, excuse me, one that went a surgical route, one that went a regenerative route. And the savings was significant. But also, keep in mind the loss of productivity that the employer is going to see with that surgical patient. You have your back operator, you're not going back to work in the next couple weeks. When we use these regenerative therapies, the patients actually get back to work a lot sooner. Number three, results. Kansas Regenerative Medicine has been in business for 5 years. As John Farley stated, they have done thousands upon thousands of patients. Their success rate overall is 70 to 80%. That is significant. That is significant. We've learned a few things along the way. Number one, this is a numbers game. The more cells, stem cells, and the more healing factors that we could deploy in an area, the better the results. That only makes sense. We've also learned that the younger the patient, the healthier the patient, the better the results. Again, makes total sense. When I first started studying this, I realized this is perfect for workers' comp, because workers' comp patients are usually younger and healthier compared to the geriatric people that I see. Now let's talk about cons. I can't think of any. I really can't think of a downside to these therapies. These therapies work so well that I'm actually using it as my go-to now for certain situations. Now let's go ahead and talk about these therapies. They're basically classified into two different types. You have your allogeneic and you have your autologous. Allogeneic simply means that we take stem cells from someone and put it in ourselves. For instance, if I take Kate's stem cells and inject it in my knee, that is an allogeneic product. Autologous means we take your cells and your factors and inject them back into you. Now, myself and Kansas Regenerative, we only use autologous factors, and I'll tell you why. We're not convinced yet that the science is there to prove that you cannot transmit a disease by taking cells from one person and giving them to another. Case in point. Back in the 70s when I was a medical student, I was tickled to death that we finally found a vaccine for hepatitis B. Because back in the 70s, we had an epidemic of hepatitis B. People were doing IV drug abuse and they were sharing needles. Unfortunately, did we not only not eradicate hepatitis B, but now in this country we have a problem with hepatitis C in the baby boomers of all people. In the baby boomers. And you probably have seen the ads on TV for hepatitis C in the baby boomers. Fortunately, there are very good antiviral medications out there that could treat it if you're able to afford it. But here's the rub. These baby boomers did not get hepatitis C 5 years ago. They got it back in the 70s. But we didn't know it existed. Therefore, we couldn't test for it. And that's the dilemma. Now, these companies that produce all these allergenic products, they'll swear up and down. They test for every disease known to man and woman. But it's the diseases that they don't know about, that they can't test for, that bothers me. So I'm not going to be giving my patient an allergenic product and then be responsible for them catching a disease 5, 10, 15 years later. And until the science proves that you cannot transmit that disease, Kansas Regenerative Medicine and myself are only using the autologous products. Now let's talk about the products. We basically break these products down into two parts: factors, which are non-cellular, and cellular products, which are the stem cells. And again, they are broken down further, again, into the allogeneic and the autologous. The only allogeneic product that is out on the market right now is called exosomes. And what that is the proteins that these stem cells actually secrete to do the job. Again, it's an allogeneic product, so I'm not going to go there. The autologous product that we use, that is a factor, non-cellular, is called PRP, platelet-rich plasma. And this is a wonderful thing. It's been used in Europe for decades. It's actually been used in the veterinary field here in the United States. It is a simple blood draw. We take blood out of you. We centrifuge out the cells and the factors that have no healing properties and keep the ones that do. We super concentrate it down and we inject it and let it do its work. About 10 years ago, orthopedic surgeons actually started using PRP, but the results were not good. And they were not good because they didn't have a good product. But now we have the science, we have the technology, the products are better, and our results are much better. And that's one of the reasons why I like to work at Kansas Regenerative, because they have a superior PRP product. The other classification is cellular, and that's the stem cell products. And again, you're going to see the allogeneic products on the market. And what these are things like umbilical cord blood, amniotic fluid, Wharton's jelly, which is actually the tissue in the umbilical cord, placental tissue. Again, it's an allogeneic product. It comes in a bottle. You don't know who it came from or how many people it came from. They've actually looked at some of these products, and to be honest with you, sometimes the cells just aren't very good. And I hear sometimes there's no cells. So I tell my patient, buyer beware. If you're going to put out some money and buy a product, make sure you know what you're getting. So the products we use at Kansas Regenerative, again, are the autologous. They come from you. The stem cells come from you. And there's two ways of getting the stem cells. One is from bone marrow, and one is from adipose. Now, everyone has heard about bone marrow stem cell transplants. They've saved many lives, especially in the pediatric hematology oncology unit. I mean, it's just a wonderful thing that we have the capability of getting these cells that we know can heal and create other cell lines. People will say, oh my God, that's got to hurt. It's got to be painful. In reality, it's not painful. We don't use general anesthesia. We don't even do sedation. It's done under local anesthetic. We stick a needle into your bone after numbing it up very adequately. We take out the marrow. Again, we centrifuge out the stuff we don't need, and we keep all the stem cells and the healing property, and we inject it. That's how simple it is. The problem with bone marrow is that as we age, our cells drop in number. So in my practice, when someone is about 65 years or older, I start to look for a different way of approaching the problem. The other way we get our stem cells is from adipose, or fat. And I got to tell you, there's a reason why God made fat, and this is it, because there's an abundance of these stem cells in adipose. Some estimates range from 400 to 2,000 times the amount of cells per unit volume in fat. The technique that I use is called lipogems. That's Lipogems. It's the only FDA-approved adipose technique in this country right now for orthopedic injuries. It was actually approved last year. It was created in Italy. And I still think I'm the only doctor in Kansas City that utilizes this procedure. Again, a simple procedure. We do a lipoaspirate where we suck out your fat, we wash it, we get the oils and the debris out that we don't want to use, and we inject it where it needs to work. The nice thing about lipogems is the fat and the cells are injected together. So the fat keeps the cells working where they could work for a longer period of time. Again, this is a numbers game. You want to get as many cells as you can, and you want them to be in the area as long as possible. So that's Regenerative Medicine 101. Let's talk about our program, Recovery Link. Having dealt with workers' compensation for many, many years, I've seen firsthand, I've heard the trials and the tribulations from case managers, adjusters, physicians, and patients on how screwed up the system could be. I've heard people complain that you can't get a patient seen in a timely fashion. Everybody knows the sooner you get the patient seen, the better the results. I've heard there's no collaboration among providers. This doctor doesn't want to talk to this doctor. I've heard there's no well-delineated treatment plan. It always seems to be an open-ended treatment plan. If this doesn't work, let's try that. You never get people to MMI, maximum medical improvement. And when you do get them MMI, nobody wants to give you a rating. Now, it's obvious to me that the workers' comp system was created with good intentions. Obviously, you want to do what's right by the patient, you want to treat the patient, and you want to get them back in the workforce. But in my opinion, right now, the way it is, it's unsustainable. It's too slow, it's too costly, and it's way too adversarial. If this workers' comp system is going to survive, it needs to be based on scientific evidence, cost-effective procedures, a well-delineated treatment plan, so at the end of the day, you get to where you need to be. Either the patient is better or they're not, but at the end of the day, workers' comp's responsibility has to end. So once I started incorporating these regenerative therapies in my practice, again, I just realized this is perfect for workers' comp. Very safe, very few side effects. The younger and the healthier the patient, the better results I'm seeing. So let's look at the program, Recovery Link. When a patient gets injured, they typically tell the supervisor, and the supervisor typically sends them to urgent care or some type of occupational medical clinic. They'll be seen by a provider, and if an x-ray is needed, they'll get an x-ray, or they'll be given a non-steroidal anti-inflammatory muscle relaxant and be told to come back in a couple weeks. Come back in a couple weeks, typically they're not better. Say, well, maybe you need a little mild narcotic, which has now become a problem. We should start some physical therapy, come back in a couple more weeks. They come back in a couple more weeks, and typically they're not better. Say, well, you've got a problem here. Go see a surgeon. They might want to do an MRI scan, or go to a PMR doctor. So they go to these providers, they get an MRI done, and they have a problem. So the surgeon says, well, go to pain manager, you get a cortisone injection. You see all the steps there? This is very simple. You send them to me for a consultation. I know what a surgical patient looks like. If it is a surgical problem, we will send them to the surgeon. If it is a non-surgical problem, I'll make the diagnosis for you. I know what tests to order. Okay, I've done this for a long time. The nice thing about our program is, go back to that. The nice thing about the program is that I get physical therapy involved immediately. Immediately. And I do that for a couple reasons. One is we start that collaborative relationship with physical therapy, because it's going to be myself and the physical therapist working hand in hand with these people for the next 4 to 6 weeks to get them better and get them back to work. Number two, the physical therapists sometimes find things I don't. And I like to have a second set of eyes on things. So you got the collaboration with the physical therapist immediately. We come up with a treatment plan. And if we decide that if regenerative medicine is the way to go, we'll go that route. If we decide a more traditional route is appropriate, we'll do that as well. We'll get the patient treated. They then go back to physical therapy. Now this is where it's very important. Next slide, Kate. This is where it's very important to send them to the right therapist, because not every physical therapist knows how to deal with a regenerative patient. A surgical knee is much different than a regenerative patient. And I found in my experience, if I send them to someone that doesn't know how to work with these patients, you don't get the results. Typically, the patient takes a week or so off. You let the cells and the factors start to work. And then there are actually algorithms that are followed to load the knee or the hip the right way, start your range of motion, to actually signal these cells to keep doing what they need to do. And it's because of this that we have partnered up with ARC, because they have that expertise. I've actually sat down with Adrian and gone through the textbooks on the algorithms that need to be used. So while they're seeing the physical therapist, they come back and see me at 2 weeks post-procedure, 4 weeks and 6 weeks, so I can make sure they're moving in the right direction, stay on top of the restrictions, and then we get them to MMI. So at the end of the algorithm, they're at MMI, case is closed. If they need a good FCE, and those of you that do a lot of workers' comp know that FCE is a very important part of this. Again, ARC probably does the most valid FCE in Kansas City, and you basically got the patient where they need to be. So at the end of the algorithm, the patient has been cleared MMI, an impairment rating has been given, and workers' comp responsibility should end. So this is the program, Recovery Link. Again, it is a program that was made to streamline the process of getting that patient seen expeditiously, making an appropriate diagnosis, having a well-delineated treatment plan with an end game, having the collaboration with the physical therapist and other providers to get them to MMI so that workers' comp's responsibility is over. That's how the system is going to survive in the future. The patient gets treated the best we can, but again, you have an endpoint. Recovery Link. Okay, thank you. And now it's my pleasure to introduce to you Adrian Strubble from ARC, who's going to talk briefly about her part of this program and why it's so important for us to collaborate. Thank you very much.
Thank you, Dr. Axe. As was shared, I'm Adrian Struble. I'm with ARC Physical Therapy. I know just a few of you in the room. I'm part of our marketing team, so it's likely you might know some of my colleagues. Brian Stewart, Tanya Konechner, Megan Leipold, other members of our marketing team. But we've been very fortunate to partner with MPR over the years and seen many of your patients, hopefully rehabbing many of them back to full duty and returning them to work. In our nearly 16-year history, we're proud to be known by many as the work comp specialists in outpatient rehab. Our mission statement has been, since the beginning, to be a catalyst of change in the healthcare marketplace. And so we were excited when Kansas Regenerative Medicine and Dr. Axe reached out for us to join Recovery Link, to be part of this movement of regenerative medicine into the work comp space. Although regenerative medicine is not new, it's still in its early stages in workers' compensation and understanding the value. So we appreciate Dr. Axe, Kansas Regenerative being here, leaders on the forefront, bringing this expertise out into the work comp market. And if we can be part of that team, bringing our expertise in workers' compensation, we're happy to be part of that team. At ARC, for every patient we see, if you want to click the next one, Kate, whether referred by Dr. Axe or another provider, we start with diagnosis and treatment. As Dr. Axe mentioned, we've sat down, we've gone over the protocols with him, being familiar with the injury a patient is coming in. We want to make sure that we have a good plan, that we're on the same page moving forward, that it's collaborative and that we're following the same protocols with open communication. From the diagnosis, we transition that injured worker and patient to their rehab, that treatment plan. So our therapists on average see about 8 patients a day, which gives them ample time to spend one-on-one time with that injured worker, understanding their story, gathering both subjective and objective data that we then share back with Dr. Axe, with Kansas Regen, with that medical team, with you, to make sure that we're all focused on what's most important, that patient, and getting them back to work that's safe and efficient. So our treatment plan is based on their job demands. So the reason we're all here is to take those injured workers, those patients, and rehab them back to work to make sure that it's safe and efficient. And so our treatment plans are based completely on their job demands. So working with you to have a job analysis so that we understand what role they do need to return to is what's vital for us in designing that treatment plan and communicating their progress back to the medical team. And then the last piece of the puzzle that we hope to bring to this collaborative approach, as Dr. Axe alluded to, is our knowledge of regenerative medicine. Our therapists have, although we're specialists in work comp, we do see patients from all walks of life in the work comp system and out of it, and have treated many patients who have had regenerative medicine procedures. And so continuing that collaboration, that knowledge shadows, working with the medical team and continuing to further our own knowledge of regenerative medicine in the work comp space is what we hope to bring to this Recovery Link team. So together we hope that these 4 slides allow us at ARC to provide data-driven, measurable outcomes. As you guys will be presented to later from Bardavon, we're part of the Bardavon network, and so we focus a lot on data and tracking our metrics, the comorbidities that might affect a patient, and working collaboratively with the medical team around those outcomes, or what might change the outcome of the patient, is what's very important to us. So we're excited to be part of the Recovery Link team. Thank you to Dr. Axe and Kansas Regen for allowing us to be part of that.
Thank you, Adrienne. Okay, I have just a couple closing points to share with you guys. KRMC has offices in Manhattan and Kansas City, and we do our workers' comp services out of the Kansas City office. We truly want to be your regenerative care, or we want to make it convenient for you, for regenerative care for your members. We recognize that patients don't want to wait to be treated, and our partners need case resolution in a timely manner. Once we get a referral, we normally get a patient scheduled and seen within 72 hours. When regenerative care is the right option, a patient can expect to be seen, treated, and released to post-treatment PT in a matter of weeks. I also want you to know, as the Director of Patient Education, that education is very important to us. For many people, regenerative care is completely new. That's why we also want to be an informational resource to you in this field. We've put together lots of great content in our handouts on our website and also through our seminars. These are how we can address concerns, put to rest misconceptions, and advise patients, partners, and advisors through every step of the process. It is important to us because this is how we get that win-win scenario we all want. In case you're feeling fidgety, we're at the end. I just wanted to quickly review with you the key benefits of the Recovery Link program. With Recovery Link, you get faster recovery, significant cost savings, quality care, strong communication, streamlined recovery, and excellent results leading to MMI. As we step into the workers' comp market, we know that we must maintain what has driven our success so far. We believe that aligns with your practices as much as always putting the patient first does. As your preferred regenerative partner, we would expect to learn from you and adapt this program based on your needs and recommendations. Honestly, the smartest thing we think we can do right now is to expand the reach of regenerative care into workers' comp, hand in hand with an excellent partner like you. And we appreciate you considering us for this. Real quickly, I'd like to share a video, just a couple minutes, words from some of our past patients.
I had stem cell therapy in my hips and my left knee. Since then, my hips are feeling a lot better.
I was in an accident where I fell off a roof. I had my neck done, my shoulders, section of my back, my hips, my sacrum, my sciatica, and my tailbone. Now I am having better range of motion in my arms and my neck and my back.
In March of this year, I had a problem with my shoulders and considerable pain. I was taking a fair amount of pain pills just to sleep at night, and heard about the Kansas Regenerative Medicine Center. I had the treatment on a Saturday afternoon. I went home and I did chores, fed the cows that night, fed them the next morning. I didn't miss a day of work. It was absolutely amazing.
He had been told that by the orthopedic specialist in Enid, Oklahoma, that they would have to fuse his thumb.
And I said, no, cut it off, because I didn't want it sticking up. There's a lot of different ways of doing this woodwork, but all of it still takes both hands. And I found out about the Kansas Regenerative and went to Manhattan.
And we were out of here in about 4 hours and on our way back home. And I'm in here today to have my shoulders, my hips, and my back done. So I'll be able to go back to my sawmill, my shop, and do about anything I want to do.
Earlier in my life, I rode bucking horses and my shoulders took such a beating, decided that I didn't want to have another surgery. I can do a lot of things that I couldn't do without a lot of pain previously.
And I was here about 2 years ago and had my shoulder, had stem cell replacement on my shoulder. And it's been super for me. It's been a wonderful 2 years. My arm not only is very mobile, but it doesn't get sore. It gives me no trouble whatsoever.
I am sold on KRMC just because I have seen it firsthand, what it does and what it's done for my husband and for my son. And there was no question when I started having trouble with my right hip what I was going to do. I knew what I was going to do.
The mobility I have in my shoulder, prior to the therapy, this was as far as I could do this fine. I guess with the rotator and everything, you can't go this way. And I would be stopped right here. Well, now I've got all that flexibility back.
I can tell you that I don't have that fear of going up and down stairs anymore. I was crippled before, and I'm not now. And I won't be getting my knees replaced for quite some time.
We are regenerative care leaders positioned at the top of that market. Now we want to deliver a program that serves you and your members and their employees. We'd love to start right now by answering any questions that you have. If Dr. Axe would like to come up here and also John to help answer any questions. Does anybody have any questions right now that either of them could answer for you? We'd love to. Right here.
I have not, and I don't know if Kansas Regenerative has the capability to bank it, but there are a few companies out there because my daughter was thinking about doing that. We found one out in Oregon, in Portland, Oregon, I think. It was very, very expensive, and I just didn't trust the process. But I think there's going to be more of them. It's a hell of a thought. I mean, that's the way to go, for sure. Yeah. Yeah. Other questions? Yes, ma'am. It's used extensively for arthritis. Yeah. Where's your arthritis? Everywhere. We could use it everywhere. Yeah. Yeah. It works very, very well. It really does. It's amazing stuff, people. It really is. Very impressed with it. Other questions? Yes, sir. Oh, good. Well, it's a very common problem, and it's a terrible problem because, you know, we're finding that actually, as I think I mentioned, the regenerative stuff has fewer side effects. And it's interesting you bring up the cortisone, because in my practice now, I'm moving away from cortisone. I'll give you a typical scenario here. You know, again, a patient falls down and hurts their shoulder, and they'll go see somebody, and again, it takes a while to get people in to see a surgeon. Surgeon finally does an MRI scan, and they say, yeah, you have a little tear in your supraspinatus tendon, which is part of the rotator cuff. Go get the cortisone injection. So they come to somebody like me, and I give them a cortisone injection. Cortisone is anti-inflammatory. So after your son probably had it done, he probably had less pain. We send them back to the physical therapist. They're saying, oh, I'm feeling better because the cortisone's starting to work. That's what it's made to do. And they start doing their physical therapy, and all of a sudden, a couple weeks later, the pain escalates. They go back to the surgeon. He does another MRI scan. Now that little tiny tear turned into a full thickness tear. He blames it on the physical therapist because they overworked me. But in reality, it was the cortisone that did the damage. We now know that cortisone damages tendons. And that's why when you have these things injected, they have to be injected under guidance. So you don't put them in the tendon. You put it around the tendon. We also know that cortisone weakens bones and cartilage. And that's why this regenerative stuff is huge. It doesn't do any of that. Again, we're just taking your healing capabilities and letting it do what it needs to do. As far as coverage, you know, the commercial insurances, they don't cover it. We've got the VA starting to cover it. Some workers' comp is starting to cover it. I think it's just a matter of time. Yeah. A good question. Yeah. Oh. That's all right.
Knowing what I know about stem cell and the benefits of it, I mean, we are pushing on our end to get this stuff covered. And I'll just give you a couple of cases. First and foremost is my husband, rotator cuff tear. He was scheduled for surgery, and me being kind of an alternative healthcare provider, I'm a chiropractor by trade, went back to medical school. So I told him, I said, go try stem cell. He is 100% recovered, and he was scheduled for surgery. Another case we had last week in our pool, I had this gentleman that I'm working with on the stuff that I do with the insurance company. He went in, had his rotator cuff repaired. Within 2 days, he was back in the emergency room with a thrombotic hemorrhoid because he lost all bowel function due to the anesthesia. So that was a complication. Then 3 days after that, he ended up having to have a catheter put in because of all the complications from surgery. So when we look at the end of the day, the cost of even trying stem cell is a fraction of what it costs to go through all the medical management of it. And I'm medical. I understand that there's a benefit and a need for both. But sometimes, and gentleman with the kid with the arm, I would never do cortisone on a young kid. I mean, maybe you did it now, but we can regenerate it now, and I have nothing to do with these folks at all. It's just for my education and knowledge, I thought I'd chime in.
That's exactly right. No question about it. Other questions?
Do you want to talk? Sure.
You know me, I hate talking. Dr. Axe actually did a procedure on me, kind of what he was talking about. I had.
Oh, by the way, disclaimer here: this was not set up at all.
It wasn't.
It wasn't set up at all.
It wasn't. But I had 3 small tears that exactly what he was talking about. And I'm a guy, right? So I let it linger for months. Thought I was kind of healed, just took things easy. Then I was moving a bounce house at my daughter's school last fall. And when I did, it basically re-injured the whole thing again. I mean, it was like the day that I had done it. I met Kate like a week later at a conference we were both presenting at. We had just started using Kansas Regenerative Medicine. They said, you know, maybe you ought to come in, talk to Dr. Axe. Let's look at this. And I think when we got back, I was in like the next day or 2 days later. When he got back into the office, they ordered the MRI, and yes, you know, traditional insurance didn't pay for this. But this wasn't work comp, I guess fortunately, I should say, since I'm at work. So it was all going to be out of pocket, but they've got discounts. They've got their own providers to be able to get me an MRI, I think the next day. Got in, got one. We found out exactly what was wrong with it. Like 3 days later, I'm in, you know, pretty painless to have blood drawn, spun, and then, you know, just put right back into the 3 spots that I had the small tears. And then we started physical therapy, and really within about 2 weeks, they released me. They're like, just do the stretches on your own because you've got full mobility back. You know, I didn't have that much pain except for when I needed it. You know, go figure. And the biggest thing is my daughter, whenever she'd get out of school, I'd reach back to stop her seat from falling out of my car, and I'd have pain every day. And now it's like I reach back and I remember that I had pain, but when I do, it's gone. I mean, I have full mobility, you know, back in it, you know, no surgery, no complications, and it's been really good. And I know that, like Allison and I were at Odessa last week talking about work comp, and we run into it. I was telling Kate, I think, you know, what we run into with employees at our members is they think we're trying to keep them from having surgery. You know, you don't want to pay for surgery. You don't really want to fix me. You want to do something cheaper, something easier. The reality is we're trying to give them something that's better. You know, their own insurance isn't even going to cover this if they wanted to do it on their own, but we're going to provide that for them because we are finding that we got better outcomes from it. It's so much faster, so much less invasive. They get the treatment quicker, they get, you know, PT quicker, and they're back at work. I mean, what we're trying to do is take care of people, and it's kind of on you guys. I think that's why we're doing this today, is so that you help your employees understand this when they come and they complain to you. We've got Allison, if they want to talk to, as the advocate. You know, us risk managers, is we're here to try to help. We're not trying to cut cords or cut corners. We're trying to make the best procedure we can for injured workers to get them back. And I'm a believer. I mean, I've done it. So you need me to come give a testimony, you know, I'm here. So I'll open it up to any more questions.
Thank you, Jason.
Yeah, Nikki? Right. Her question for those watching online is, can you use your HSA? Yes, you can. It's a medical procedure. I use mine. I can't remember exactly. And each procedure, I think, is what you're getting is different. But if you call them, they'll tell you up front what that cost is. And like for the MRI, it was significantly cheaper. And as you know, traditional insurance, you're going to PT for 6 weeks before they're even going to give you the MRI. I mean, I had the MRI, I think 2 days later. And we were doing our plan, and we were down, you know, the road to recovery within a week, instead of the long road to let's figure out what's going on.
Any other questions? Yes, sir. Oh, I'm sorry. I wish I knew the answer to that. It can't be soon enough, I can tell you that. I just don't know. I don't know. VA has jumped on this pretty big, and thank God to help the veterans. But I think that's huge, and I think it's going to be sooner than later that the commercial payers come around.
In order to try and answer your question, David, also, I have read some recent laws from the state of Arkansas where they're saying in workers' comp, if you have an injury that qualifies for stem care, you have to use stem care first. So I thought that was really awesome, and coming from Arkansas, I thought it was kind of crazy. I really would have expected that from one of the coasts instead, but so I thought that was hopeful at least. And our program obviously covers it in workers' compensation. We like to try things that are maybe not so conservative and maybe not so invasive. And that's the idea behind it, is that surgery's invasive and anything could go wrong when you're in a surgical situation. So why take that chance? If your injury qualifies for stem cell treatment, why not go that route? I also had stem cell done, and mine was a workers' comp claim. I was a little embarrassed about it. I went to Terry and said, I'm really sorry, but I think I have a workers' comp claim, and I'm sorry because I'm the director of the workers' comp program. And he said, don't treat it any differently, So I contacted Thomas McGee and explained to them, and they gave me an adjuster who's not normally on our account, and I talked to Nancy Bobbitt. She's our nurse advocate in our program, and she got me set up for stem cell. And now the way that I had a partial thickness rotator cuff tear, similar to what Jason was saying. Full thickness tears, I don't think really qualify for stem cell. You probably do have to have a surgical procedure when it's full thickness. But on a partial thickness tear, why not? And my entire claim was less than $3,500. And I was back to 100% within a month. What's really important to say also is that not any physical therapy place will work for this. And that's why Kansas Regenerative has partnered with ARC, because that's who MPR uses, and ARC understands the difference between stem cell treatment and surgery. And the physical therapy process afterwards has to be different, or you're going to hurt yourself because you didn't get surgery. It's not fixed yet. It's going to take time for those cells to find the place where they need to go and start their repairing process. So they took fat tissue from my back, and it was just like what you would see, back in the day, maybe 20 years ago, when everybody was doing the little vacuum treatment, whatever that was called, where they would vacuum out your cells in order to lose weight. So right. So that's what they did. They sucked out some of I tried to get them to do the other side too, but they wouldn't. And then they spin it. They get my cells that are already out of my own body, and they put them back in the area where is necessary. And it was really cool because I watched the whole thing on the screen, because she had her assistant holding the whatever, the little device that for the ultrasound, so that I can see it on the screen the whole time. I saw the needle coming in and going to the area, and I saw the stuff coming out into my shoulder, and I thought that was really kind of cool. And it was so numb that you don't feel it anyway. Basically, I had 2 hours to get home and find a comfortable place before the pain started, and it didn't last very long. I mean, within a couple of days, I was fine again and back to normal. You baby it for a while because, like I said, it's going to take some time for the repair process, but I highly recommend it. And even in other cases, like if there's a severe accident, car accident or something where you have multiple injuries in your body, I think stem cell as a supplement also helps your body to correct itself.
That's correct. That's absolutely correct, and we do see a lot of that.
Yeah.
Yeah.
Sometimes we do bring them up from other areas of Missouri. We found a place in Springfield that we've used once or twice, but we kind of like the outcomes at Kansas Regenerative better, and so it's worth it to pay the travel. And in fact, Kansas Regenerative will put them up into a hotel the night before as part of the payment or the process for the whole procedure. So yeah, I think it is worth it to bring them to a place where you know you're going to get good outcomes. Yeah. Does anyone else have a question? The fat cells or the bone marrow? Oh, the blood is the PRP, right?
So the fat cells have the actual cells. So how do I determine? It depends on what we're treating. Depends on the age of the patient, the health of the patient. Again, the healthier you are, the better results. You know, I think I mentioned that when you hit about 65, that bone marrow starts losing some cells. It's typically when we go to fat. When we do the cellular part of our algorithm, we use PRP as well. Okay, now sometimes PRP, like Jason had, was all he needed because he had a very, very, very minor injury compared to what we see. Some of the more severe injuries, we really need to get those cells in there working as well. Yeah. Good question.
Based on the one-on-one consultation with Dr. Axe, he can really look at your images to determine, and overall health and medical history, to determine what is right for you. So that's why it's important to get face-to-face with him and go over that together.
I had the PRP done about 15 or 16 years ago when I worked at Lockton Companies, and I had tennis elbow, and I don't like surgery. I don't like the invasive process, and I would do anything else first. That's just my personal approach. And so I had the PRP done in my elbow, and it's great, worked fine. It took a little bit longer for that approach than it did with the stem cells in my shoulder because I could still feel it a couple months in, but then it was like one day just gone, and it was so subtle that I didn't even remember that I had it for a while, and then I realized that the pain had been gone. So yeah, it just depends on the situation, and it's your own body fixing itself, which is pretty cool.
Any other questions? Well, thank you so much. You guys are fun. Yeah. Have a nice day. Enjoyed it.
Thank you guys so much for inviting us. Thank you, Melanie. Thank you, Allison, for putting all this together and inviting us to speak. We really appreciate it. And thank you, MPR, for listening.
They're probably getting the food set up right now, I assume. Yeah, so we could take a few minutes to take a break before we get some food, and then come back in here and we'll keep going.
Have a nice day.
Thank you.